Then the second part of my talk, of course, focused on Nectin-4 targeting. This is a very important target in urothelial cancer since it is the target of enfortumab vedotin, the antibody-drug conjugate that really transformed the metastatic treatment landscape in urothelial cancer. And there's now pretty good data for imaging of Nectin-4 in urothelial cancer. There was a study with gallium N188, which is a radiotracer with high affinity for Nectin-4 and has pretty good ability to image Nectin-4 expression in a variety of tumors, and particularly in urothelial cancers, and as a result, can potentially select patients for Nectin-4 targeted therapy without having to, for instance, have those patients undergo biopsies to confirm Nectin-4 expression, because there's a pretty good correlation in gallium N188 SUV values and Nectin-4 expression and histopathology, as now described on a couple of studies published out of China. As a result of this, I think the next step is we're thinking about Nectin-4 targeted radiopharmaceuticals as well. And there's a trial coming out from actually Actis Oncology of a Nectin-4 targeted radiopharmaceutical that's a first-in-class drug in that space. And that will be initially a dose escalation study in metastatic urothelial cancer patients, and then eventually a dose expansion study in urothelial cancer and in other tumors as well. So to summarize, I mean, I think there is actually a lot of promise for radioligand therapies in urothelial cancer, but these are really the early days of this. I think FAP targeted imaging has very promising data for more accurately basically imaging and staging patients with urothelial cancer. There's a potential role for FAP-targeted radiopharmaceuticals and a role for Nectin-4 targeted imaging and radiopharmaceuticals as well. I didn't talk about this as much at the presentation or with this brief summary, but there's a possibility of other radioligand therapies for other established targets in advanced urothelial cancer as well, whether that's TROP2, HER2, or some of the other targets in urothelial cancer that we use. So I think there's again a lot of promise in this field and a lot of further developments to come.